call my plan the American Health Choices Plan. If you have private insurance you like, you can keep that insurance. If you like the doctor you have, you can keep seeing that doctor. If, however, you don't have health insurance, or you don't like the insurance you have, you can choose from the same wide variety of private plans that members of Congress choose from.
Hillary Clinton and Paul Krugman, New York Times columnist, your response?
Well, it's a good plan. I mean, the sequence here has been that John Edwards broke the ice in February, and he came out with an actual doable, financeable plan that you can imagine actually passing, and that was amazing. And essentially, the Clinton plan and the Obama plan are, you know, if you're a real health policy wonk, there are some fine points that differ, but they're fundamentally the same plan. I actually have taken to calling it the demo plan. It is a route to universal health care. It's not exactly the program that I would have gone for in an ideal world without politics. You know, if I could do it, if I didn't have to worry about getting it through Congress and the various, you know, the political maneuvering that will take place, I'd probably just say, let's have Medicare for everybody. But this is not bad. This is and we can get the principle of universal health care established if any of these plans goes through. I find myself actually sometimes pinching on myself to say, am I dreaming? Because, you know, 2.5 years ago, the question was, could we stop Bush from privatizing Social Security? Now we're actually looking at the real possibility of universal health care by about 2010.
Single payer?
These plans are interesting. They're not single payer, but they can evolve into single payer. You know, single payer would be Medicare for everybody. And there are problems. That's the right way to go in terms of the sheer economics. That's the cheapest, most efficient plan. The problem is it requires a fairly large substitution of taxes for healthcare premiums, which would be smeared as, you know, this is just higher taxes and you won't actually save any money. And it would also appear to reduce choice, and it probably wouldn't in reality. These plans they build on the existing private insurance system, but crucially, they also allow people to buy into a publicly run plan, which would compete, and I believe actually would in the end kill the private plans in the competition. So it's a route that can lead to single payer, but the main thing is it gets you universal coverage, and it gets you right away, and it doesn't require any legislation that doesn't look like something it could actually pass if you give me, 55 Democrats in the Senate and 240 in the House.